Bismillah Rahman Rahim. My name is Dr. Ali bin Saeed. I am working as Assistant Professor of Cardiology in Multan Institute of Cardiology, Multan, and I am providing my services for almost 24 years. So why we are discussing hypertension so frequently and at different forums? Because we all know that hypertension is a silent killer and it has got deadly complications like stroke, CVA, heart failure, myocardial infarction and renal failure, retinopathy, and also the macro complications. So this is a very common condition, and all the specialties providing healthcare services like either it is a tertiary care centers, it is secondary DHQs, it is a primary care centers, it's all the specialty, either they are nephrologist, cardiologist, endocrinologist, pulmonologist. Everybody has to see this condition because this is a very common condition, and if it is not controlled at a very early level, then it can lead to the complications, and the treatment of the complications, the management of the complication is very costly, and they are not cost effective. They are burden on the society and the individuals also. Like we have the patient has developed myocardial infarction, then we need angiography, plasties, a lot of expertise and expenses. If the patient develop the CVA, then the patient become crippled, and it's a burden on the disease, on the society, on the individual, and on the family also. And the patient is developed renal failure, then dialysis, then it is very difficult to treat the complications. So that's why we need to control this hypertension at a very early level. And it can be controlled if the people are properly trained. And we have the most important thing, unfortunately we don't have a centralized national database registry. So we all know that different countries have developed different registries so that they have authenticated data. We all know that our 80% of the population, they have an access to the primary care center, but only 15% of the people, they have access to the tertiary care centers. So fortunately, GATS has taken an initiative to develop this registry program under the umbrella of PREACH program, that is Prevention, Management and Control of Hypertension, and they have developed almost 14,000 centers all over the Pakistan. That is a very good thing. So now we can have a very good authenticated data about hypertension. When we have this authenticated data all over the Pakistan, then we can develop a consensus between different sectors who are providing healthcare, and they are related to healthcare professionals, and they are providing healthcare services. Either they are from the policymaker and or either they are from the providers. So when we have this registry, so we can have a very good consensus. We have very good consensus to control this silent killer hypertension. The only objective of this registry is to have authenticated data, and at the end of day, when we have authenticated data, we can present this to the policymakers, and we all can work together synergistically and also holistically to control this hypertension, to decrease the burden of this deadly disease, the silent killer hypertension. Thank you very much.